When working with a client with trauma, one of the roles of a yoga therapist is helping the client get to the point that talk therapy is effective. And why, after enduring a trauma, is it often not as effective to just go directly to talk therapy? Because trauma and the memory of trauma stays mainly in the right limbic area of the brain, and the speech center in the left prefrontal area is shut down. There's very little activity, especially when remembering a traumatic event. And the issue there is that right brain is not connecting well to left brain. So a very effective thing that we've found when working, especially when I'm working in a team situation with a psychotherapist, is use of cross-patterning and crossing midline in the body. Crossing midline, you might even try something just like brushing opposite sides of the face. It feels very strange, as though someone else is doing it. I remember games as a child that we would play, and kids tend to cross pattern and mix it up a lot more than we do. My mom would play the game of earsy nosy, where we're asking one side of the body to do one thing, the old rubbing your head and rubbing your tummy and patting your head thing, or can you make your fingers go opposite directions rather than chasing? And sometimes in this situation, it's less triggering to do playful things with even adult clients than to go right for very, very serious stuff. So what you might do, for instance, if I'm down on my back, like so, I might do some what would appear to be core exercises where my knees would swivel to the left as my head would swivel to the right, and then I'd change that direction. And generally, that's when we start laughing, because it's difficult. Other things you can do here are, for instance, circles of the knees and circles of the hands going the same direction, and then opposite directions, so that we're asking the body to swivel and then try to get the head into that movement as well. So those are playful things to do, working with clients with trauma. I'm going to move to a chair here for a bit and show you a couple of other things. I do this with kids. I also do it with adults. Sometimes it takes just the natural movement of when we walk, right? This is a cross-patterning movement, this cross-crawling movement. It's even more effective sometimes if we touch right to left and left to right, making that like jumper cables from one side of the brain to the other. But sometimes if they're experiencing a lot of anxiety, it's fun to just go for a chair run and play with that movement of working across the body. Other fun things are things like just taking one shoulder one direction and one the other. Even just one shoulder and the other in the opposite direction. So as things get a little, as we get a little more into the work, sometimes bringing the eyes into the practice, like when they're working with EMDR. So a movement like just a simple twist, yeah, and then I'll turn this way so you can see what I'm doing with the eyes. And sometimes this can feel jumpy because we're working in the nervous system, and the nerve, we get that little jumpy nerve action. But to sit tall, take the eyes back, and then gradually begin to turn the head out, leaving the eyes back. nice little plus of this movement is, and it can feel really weird. So don't be surprised. Give them a break in between, or give yourself a break if you're doing it. Eyes back, head slowly turns out. Then notice how you feel. Another little side benefit here is that it can help with neck pain, with eye-related neck pain. Often following that movement to sort of ease the odd feeling of it, taking pictures with the eyes, looking right and left and up and down, squeeze, pop, until the eyes feel relaxed and moist. And then, of course, we do the same action to the other side. So those are some ideas for working with cross-patterning and crossing midline when working with trauma. Namaste.